Good morning, everyone. Just imagine you're diagnosed with the worst thing you can imagine, and that's cancer. You don't know what to do, and then you realize there's a lot of things that are there to help you, including the American Cancer Society. The American Cancer Society is dedicated to free the world from cancer through research, supporting patients, information, and then trying to figure out new prevention methods. Today, I plan on discussing with y'all the American Cancer Society. I wish there's enough time to discuss everything, but I'm going to focus in today on the organization, the statistics of cancer, and how they aim to end it. The first topic we're going to talk about is the history. According to the American Cancer Society website, the society dates back 104 years. It was originally founded by 10 doctors and 5 laypeople in New York City. It was originally called American Society for the Control of Cancer, or ASCC. Cancer was essentially a death sentence. If you had it, doctors didn't know how to tell you, so they chose not to. And if they did tell you, you didn't know how to tell your family because it was basically the end. Founders believed it was important to bring cancer into the spotlight. They published articles, they had a monthly bulletin called the Campaign Notes, which brought new information they discovered into the light. The Sword of Hope symbol, which is the now symbol of the American Cancer Society, it actually came from a poster contest they had in 1928, which was hosted by the ASCC and the New York City Cancer Committee. The sword is supposed to represent the crusading spirit of cancer control movement, and the twin serpents represent the medical and scientific research and nature of the work. In 1936, the Women's Field Army was founded by Marjorie G. Illig. She was the chair of General Federation of Women's Clubs Committee on Public Health. They went out to the street and raised money to educate the community about cancer. In 1935, they had 15,000 people who were active in the control, and by 1938, it was 10 times that number. In 1945 through 1947, there was major things that occurred that changed the organization to what it is today. In 1945, the ASCC changed their name to the American Cancer Society. In 1946, philanthropist Mark Lasker, he raised $4 million for the organization, and he donated $1 million for research and basically created it. In 1947, they became famous for the Cancer Signal Campaign, which is a public education group to inform others of signs and symptoms of cancer. And then Dr. Sidney Farber, he was one of the original first research grantees. He achieved the first temporary remission of a child with acute leukemia with a drug, which is now how they do modern chemotherapy. And since 1946, they've invested well over $4 million into research, which allowed 47 researchers to win the Nobel Prize. And then in 1971, they later contributed to the passage of National Cancer Act in 1971. It basically allowed them to fund and allow the expansion of the National Cancer Institute. Now that we've talked about the history, I want to talk to y'all about the statistics of cancer. And in 2016, there's an estimate of 1,685,210 cases of cancer being diagnosed and a projected 595,600 passing away. The most common cancers were breast cancer, lung cancer, prostate cancer, bladder cancer, pancreatic cancer, non-Hodgkin lymphoma, melanoma, endometrial, renal pelvis cancer, pancreatic cancer. There was a bunch. And the number of new cases was 454 per 100,000 men and women per year. Cancer mortality rating is 171.2 per 100,000 men and women a year. The cancer mortality rate is greater among men than women. It's 207 per 100,000 men and 145 per 100,000 women. Cancer is more prevalent in African American men, which is 261 per 100,000, and it's lowest in Asian women, which is 91 per 100,000 women. And in 2014, they estimated 15,700 kids or adolescents between 0 and 19 would be diagnosed with cancer, and 1,900 of them would pass away. And approximately 39.65% of men and women will be diagnosed with cancer at some point in their life. And the mortality trends. It's a very sad subject, unfortunately. But The overall death rate has declined since the early 1990s. It's a 1.8% decrease among men, 1.4% decrease among women, and 1.4% decrease for children. Now that we've talked about the statistics, I want to talk to y'all about how they're aiming to end cancer. They're doing a bunch of research and testing and different things to see how they can do that and how they can end it. As of right now, they've did 68, as of 2014, they've done 68 interventions to reduce colorectal cancer rate in specific communities that are mainly affected with it. And in 2013, they did 66 new interventions for people with breast cancer and try to figure out ways to end that. In 2015, they did 203,000 multi-channel resource navigation options, which are able to help people with cancer and teach them more about it. And then in 2015, they improved access to care for those more likely to experience inadequate cancer treatment, and they increased the numbers by 261,500. So today we discuss the American Cancer Society. We keyed in on the history, the statistics, and how they're aiming to end cancer. The American Cancer Society is dedicated to free the world from cancer through an abundance of research, supporting patients, providing information, and discussing things that people don't know. And if you think about it, there's many people throughout the world who are affected. People in your state, your neighbor next door, even your family. I personally have a lot of people in my family, such as my grandparents and great-grandparents, who were affected by cancer. And it's a very tough thing. Any person can be affected. It could end up being one of us. And it's something detrimental. Whereas being in the fire service, I know that I'm at a higher rate for a lot of cancers because of the job I do. So this is something that's very important to me. And throughout the years, the 113 years the American Cancer Society has been around, they've helped millions of people, and they will continue working to reach their goal of ending cancer throughout the nation. And I hope this was very informative for y'all, and I hope y'all have a great day.